Alright, in this explainer, we are diving deep into acute viral hepatitis. We're going to uncover what happens when a handful of specific viruses decide to attack one of the most hardworking, underappreciated organs in your entire body, the liver.
So let me ask you this. What if your body's most vital factory just suddenly went on strike? Because that's pretty much what we're talking about with viral hepatitis. Your liver is this incredible, complex factory running thousands of critical operations every single day. And this illness is what happens when that factory is forced into an emergency shutdown.
Okay, so what is it technically? Acute viral hepatitis is a systematic infection, meaning it affects the whole body, but its main target is the liver, causing major inflammation and damage. The key word to hang on to here is acute, which means it usually runs its course in less than 6 months. And it's not just any virus. We're talking about one of 5 specific viruses that have a particular vendetta against the liver.
Now, to really get a grip on this, you first have to appreciate just what the liver does. When it gets inflamed, all of its critical jobs, everything from cleaning your blood to producing proteins essential for life, get thrown into chaos. But the way the liver actually gets injured, well, it isn't as straightforward as you might think. It turns out, the damage is coming from 2 different directions. First, you've got the virus itself, which acts like a tiny wrecking ball inside the liver cells. But believe it or not, the more significant damage often comes from friendly fire. Your own immune system spots the infected cells and launches this massive, all-out attack, causing widespread inflammation in the process.
Alright, so who are these troublemakers? Let's meet the main lineup. There are 5 of them, and you can think of them like a gang of intruders. Each one has a different way of breaking in and a different long-term goal.
And this is super important. While they all end up in the same place, the liver, how they get there and what they do next can be worlds apart. This difference affects everything, from how a person might catch the virus to whether it could become a lifelong problem.
Okay, this chart really lays it all out. You can see the different personalities of these viruses. Notice that big split? Hepatitis A and E are generally spread through contaminated food or water, the fecal-oral route. But B, C, and D are transmitted through blood and body fluids. Now look at hepatitis C. See that 75 to 85% chance of becoming chronic? That's why it's called the silent epidemic. And then there's hepatitis D, the ultimate sidekick virus. It's so unique it can't even infect you unless you already have hepatitis B.
So to really boil it down, you can think of them in 2 main camps. First, you've got A and E, which are mostly about hygiene and sanitation, what you eat and drink. Then you have the other camp, B, C, and D, which are transmitted parenterally, meaning through routes other than your gut, like blood. It's a really useful way to keep them straight.
So once a person is infected, the illness doesn't just happen all at once. It actually tends to follow a pretty predictable 4-act play, a journey from the moment of exposure all the way through to recovery.
The path of the illness usually looks like this. It starts with the incubation period, where the virus is multiplying, but you feel totally fine. Then comes the prodromal phase, where you start to feel kinda crummy, vague flu-like symptoms. That's followed by the most dramatic stage, the icteric phase, which is when jaundice appears. And finally, you enter the convalescent phase, which is just a fancy word for recovery. Now, this icteric phase is where the liver's dysfunction really goes public, you could say. The hallmark symptom is jaundice, that yellowing of the skin and eyes. And why does that happen? Well, the liver is so overwhelmed it can't process a waste product called bilirubin. That same bilirubin then spills into the urine, making it dark, while the lack of it in your gut makes your stools look pale. It's literally your body showing on the outside the struggle that's going on inside. So with all this going on, how do doctors actually figure it out? It's a bit like a detective story, really. They have to gather evidence of the damage and then identify the specific culprit responsible for the crime.
The diagnosis is basically a 2-step process. The first step is to find the collateral damage. They use lab tests that show how badly the liver is actually injured. Then, once they've confirmed the liver is under attack, step 2 is to find the virus's unique fingerprints to figure out which of the 5 is to blame.
So what are these clues telling them? Well, when liver enzymes like ALT and AST are sky high, it's like the liver cells are screaming for help. High bilirubin, of course, explains the jaundice, but the one doctors watch like a hawk is the prothrombin time, or INR. If that number starts to climb, it's a huge red flag that the liver is failing to produce the factors your blood needs to clot. Okay, now before we look at the specific fingerprint tests, we have to get this one key distinction down: antigen versus antibody. Think of it this way.
An antigen is a piece of the virus itself. It's the wanted poster. If you find the wanted poster, you know the criminal is in town right now. An antibody, on the other hand, is your body's response. It's the police force your body builds to fight the virus. Finding the police force proves you've been exposed, either recently or in the past.
So, keeping that wanted poster versus police force idea in mind, we can see the specific clues doctors look for. For viruses like A and E, they look for the early response police force, the IgM antibodies. For hepatitis B, it's a combination of the wanted poster and the police force. And for hepatitis C, the most precise test goes even deeper. It looks directly for the virus's genetic material, its RNA. This is how they pinpoint the exact cause.
All right, so the diagnosis is in. What happens next? In our final section, we'll look at the outcomes and, most importantly, how to prevent this from happening in the first place.
So what's the typical outcome? Well, the good news is, for most adults, about 85% will make a full and complete recovery. However, that 14% risk of it becoming a chronic, lifelong infection is significant, especially with hepatitis C. And then there's that tiny but terrifying 1% that can progress to fulminant liver failure, which is a rapid, catastrophic shutdown of the organ.
And for most of these acute infections, there isn't some magic pill to make it go away. The treatment is all about supportive care. That means rest, good nutrition, and, this is a big one, avoiding anything that puts more stress on the liver, like alcohol or certain medications. The whole goal is to give your body's immune system the best possible chance to win the fight on its own.
Of course, the absolute best strategy is always prevention. Good hygiene is critical for hepatitis A and E, while safe practices around injections and sex are crucial for B, C, and D. But our most powerful tools, the real game changers in our arsenal, are the incredibly effective vaccines we have for hepatitis A and B.
Which brings us to our final and maybe most important thought. Safe and effective vaccines exist that can completely prevent infection from two of the most common and dangerous of these viruses. So the question I want to leave you with is a simple one. Do you know your status?